Men's health after 60, 6 essential things you should never do to your penis. Introduction: your health journey after 60. If you care deeply about your health and want to protect one of the most vital and important parts of your body, this comprehensive message is specifically for you. I'm Dr. James, a board-certified urologist and men's health specialist with over 2 decades of experience helping men navigate the complex challenges of aging gracefully while maintaining their sexual health and overall well-being. Today, we're going to embark on an important journey together as we explore 6 critical things you should never do to your penis after turning 60. This isn't just another health article, it's a comprehensive guide based on years of clinical experience, scientific research, and real-world observations from treating countless men who have faced these exact challenges. As a doctor who has dedicated his career to men's health, I understand just how crucial it is to take proactive care of your sexual health as you age. The reality is that your penis represents much more than just a physical organ. It's a powerful symbol of your overall well-being, your masculine confidence, your intimate relationships, and your fundamental quality of life. When your sexual health thrives, it creates a positive ripple effect that touches every aspect of your existence. In this detailed exploration, I'm going to share 6 essential principles and strategies that you probably didn't know could have such a profound and lasting effect on your long-term health, happiness, and vitality. These aren't just theoretical concepts. They're practical, evidence-based approaches that can genuinely transform your health trajectory for the better. I want you to stay with me until the very end, because the final point I'll share might truly surprise you and could be the key to unlocking a more vibrant and fulfilling chapter of your life. Before we dive deep into this important content, I encourage you to approach this information with an open mind and a commitment to your own well-being. Let's begin this important exploration of why your penis deserves the very best care, especially after reaching the milestone of 60, and how these practical yet powerful strategies can create meaningful, lasting improvements in your health and overall life satisfaction. Understanding the importance of sexual health after 60. Before we examine the specific things you should avoid, it's crucial to understand why sexual health becomes even more important as we age. Many men mistakenly believe that sexual health naturally declines with age and that there's nothing they can do about it. This couldn't be further from the truth. Your sexual health is intricately connected to your cardiovascular health, hormonal balance, mental well-being, and overall quality of life. When you take care of your sexual health, you're simultaneously protecting your heart, maintaining healthy hormone levels, preserving your mental clarity, and ensuring that you can continue to enjoy intimate relationships well into your golden years. The changes that occur after 60 don't have to be inevitable or irreversible. With the right knowledge, approach, and commitment to self-care, you can maintain robust sexual health and continue to enjoy a fulfilling intimate life for decades to come. 1. Don't ignore changes in erections, your body's early warning system. As you progress through your 60s, 70s, and beyond, one of the most important and revealing signals your body can provide you with is through the quality and consistency of your erections. This is perhaps one of the most overlooked aspects of men's health, yet it's incredibly significant for your overall well-being. Many men fall into the trap of believing that losing firmness, having difficulty achieving erections, or struggling to maintain them is simply an inevitable part of getting older, something to reluctantly accept and quietly ignore. However, this perspective is not only incorrect but potentially dangerous to your long-term health. Here's the critical truth that every man over 60 needs to understand. Changes in your erections function like the check engine light of your entire body. They're not something to brush off, feel embarrassed about, or dismiss as normal aging. Instead, they serve as a valuable window into your overall health status, particularly regarding your cardiovascular system and hormonal balance. The cardiovascular connection. Your penis relies heavily on adequate blood flow to function properly. The process of achieving and maintaining an erection is fundamentally a vascular event. It requires healthy blood vessels, proper circulation, and efficient blood flow mechanics. When you're experiencing issues with your erections, it can often serve as an early warning sign of developing cardiovascular disease. This connection is supported by extensive medical research. Studies consistently show that erectile dysfunction can manifest years before more serious cardiovascular problems like heart attacks or strokes become apparent. This happens because the blood vessels in your penis are relatively small and particularly sensitive to changes in circulation. They're essentially the canaries in the coal mine of your vascular system. When these smaller vessels begin to show signs of dysfunction through decreased blood flow, reduced responsiveness, or impaired dilation, it often indicates that your larger blood vessels, including those supplying your heart and brain, are beginning to show similar signs of narrowing, hardening, or other cardiovascular issues. This early warning system gives you a valuable opportunity to address cardiovascular risk factors before they progress to more serious conditions. By paying attention to changes in erectile function and seeking appropriate medical evaluation, you can potentially prevent heart disease, stroke, and other serious cardiovascular complications. Hormonal implications. Beyond circulation issues, changes in erections can also reflect significant hormonal imbalances, particularly declining testosterone levels. Testosterone is a crucial hormone that affects far more than just sexual desire and function. It plays a vital role in maintaining your energy levels, mood stability, muscle mass and strength, bone density, cognitive function, and overall sense of vitality and well-being. If your erections aren't what they used to be, it could be a clear indication that your body's testosterone levels have dropped below optimal ranges. This decline, known as andropause or late-onset hypogonadism, can have wide-ranging effects on your physical and mental health. Low testosterone can contribute to fatigue, depression, decreased motivation, loss of muscle mass, increased body fat, reduced bone density, and decreased overall quality of life. By recognizing erectile changes as a potential sign of hormonal imbalance, you can work with your healthcare provider to evaluate and potentially address testosterone deficiency. The importance of professional evaluation. The key message here is that ignoring these changes doesn't just put your sex life at risk. It can be a warning that your entire body needs attention and care. When you pay attention to your erections and take them seriously as health indicators, you're also taking proactive steps to protect your heart, optimize your hormones, and maintain your mental well-being. If you've noticed changes, perhaps you're waking up with fewer morning erections, sexual activity doesn't feel the same as it used to, or you're experiencing inconsistent erectile function, don't automatically assume it's just a normal, unavoidable part of aging. Instead, view these changes as valuable information about your health status and take action. A simple, honest conversation with your doctor can be the crucial first step toward protecting your overall health and reclaiming your vitality. Many effective treatments are available, from lifestyle modifications to medical interventions, that can help restore erectile function while simultaneously improving your cardiovascular and hormonal health. 2. Avoid home remedies and miracle cures. The dangerous gamble. After turning 60, it's completely natural and understandable to want to maintain and protect your sexual health and performance. The desire to hold on to your vitality, maintain your confidence, and continue enjoying intimate relationships is both normal and healthy. However, this natural desire can sometimes make you vulnerable to questionable solutions and potentially harmful approaches. In today's world, there's tremendous pressure and endless temptation surrounding quick fixes for sexual health issues. You're constantly bombarded with internet advertisements promising miraculous results, well-meaning but often misguided advice from friends and acquaintances, and marketing for various miracle cures, home remedies, or secret potions that claim they can restore your erections to their youthful vigor or even make your penis larger. Why these solutions are dangerous. Here's the stark reality that every man needs to understand. These quick fixes are often anything but harmless, and they can cause significantly more damage than good. Your penis is a remarkably sophisticated and finely tuned organ, with complex vascular, neurological, and hormonal systems working together to create normal function. After 60, these tissues become even more delicate and sensitive to potential harm. When you experiment with unproven approaches like homemade penis pumps, herbal pills containing unknown or unregulated ingredients, or those supposedly magical oils and creams that claim to boost performance overnight, you're essentially gambling with your health in a way that can backfire dramatically and sometimes irreversibly. Many of these so-called remedies lack any scientific backing or clinical testing. Even worse, some can lead to serious complications, including scarring of penile tissue, nerve damage, permanent deformity, chronic pain, or even permanent erectile dysfunction. The irony is that in trying to improve your sexual function, you might actually destroy it permanently. The psychology behind the appeal. It's easy to understand why these ideas are so tempting and appealing. The frustration and worry about changes in sexual function can make anyone vulnerable to promises of quick, easy solutions. The marketing for these products often preys on men's insecurities, fears about aging, and the completely natural desire to maintain their sexual identity and capability. These companies understand the psychological vulnerability that many men experience when facing sexual health challenges. They exploit feelings of embarrassment, fear of judgment, and the desire for privacy by offering solutions that seem discreet and self-manageable. However, your health and dignity deserve much better than these predatory marketing tactics. The safe and effective alternative. Instead of risking injury, disappointment, or permanent damage with these unproven and potentially dangerous methods, it's infinitely safer and far more effective to work with a trusted healthcare provider who specializes in men's health. There are numerous real, scientifically proven treatments available that work with your body's natural systems rather than against them. These medically supported options include FDA-approved medications like PDE5 inhibitors, Viagra, Cialis, Levitra, hormone replacement therapy when appropriate, vacuum erection devices that are medically approved and properly designed, penile injections, lifestyle modifications that boost blood flow and hormone balance, and even advanced treatments like shockwave therapy or penile implants when necessary. These legitimate medical interventions are backed by extensive research, clinical trials, and years of safe use. They're prescribed and monitored by qualified healthcare professionals who can ensure they're appropriate for your specific situation and health status. The true cost of DIY approaches. Attempting to fix sexual health issues on your own with risky home remedies isn't just a waste of money. It can actually set you back significantly, turning a manageable problem into a much more complex and serious condition. What might have been easily treatable with proper medical care can become a permanent disability requiring extensive intervention or surgical correction. Remember, taking care of yourself properly isn't about finding shortcuts or avoiding medical care. It's about treating your health with the respect and professional attention it deserves so you can continue enjoying a vibrant, fulfilling sex life for many years to come. 3. Keep it clean, but be gentle. The art of proper hygiene. Good hygiene represents one of the simplest yet most powerful ways to protect your penis and maintain optimal sexual health, especially as you grow older. This might seem like basic advice, but the reality is that many men either don't pay enough attention to proper genital hygiene, or conversely, they overdo it in ways that can actually cause harm. Why hygiene becomes more critical after 60. After reaching 60, your skin undergoes significant changes that make proper hygiene even more important. Your skin becomes thinner, more delicate, and less resilient. It produces fewer natural oils, becomes more prone to irritation, and takes longer to heal from minor injuries. These changes make it crucial to treat your genital area with extra care and attention. Proper hygiene isn't just about freshness or cleanliness, it's fundamentally about preventing infections, reducing irritation, and avoiding more serious health problems that can develop over time. Poor hygiene can lead to bacterial overgrowths, fungal infections, inflammatory conditions, and even more serious complications that can significantly impact your sexual health and overall well-being. Special considerations for uncircumcised men. For men who are uncircumcised, cleaning under the foreskin becomes particularly essential, though I understand this can feel awkward or embarrassing to discuss even with your doctor. However, this aspect of hygiene is crucial for preventing health problems. The area under the foreskin provides a warm, moist environment that can easily harbor bacteria, dead skin cells, and other debris. When this material accumulates, it forms a substance called smegma, which can lead to irritation, unpleasant odors, and infections such as balanitis, inflammation of the head of the penis. The proper technique involves gently retracting the foreskin and washing underneath with warm water. This should be done daily during your regular shower or bath routine. It's important to be gentle during this process, as forceful retraction or aggressive scrubbing can cause micro teat hairs in the delicate tissue. If you notice any redness, swelling, persistent unusual odors, discharge, or discomfort, these are signs that your body is telling you something needs medical attention. Don't ignore these symptoms or try to treat them with over-the-counter products without consulting your healthcare provider. The dangers of over-cleaning. While cleanliness is important, there's definitely such a thing as overdoing it, especially after 60. Using harsh soaps, scrubbing too vigorously, or using heavily scented body washes can strip your skin of its natural protective oils. This can lead to dryness, micro tears in the skin, increased susceptibility to infections, and even allergic reactions. Your genital area doesn't require fancy soaps, strong antibacterial washes, or aggressive cleaning products. In fact, these products can disrupt the natural bacterial balance of your skin and cause more harm than good. Warm water and a mild, fragrance-free cleanser are more than sufficient to keep the area clean and healthy. The key is finding the right balance, cleaning thoroughly enough to remove bacteria and prevent infections, but not so aggressively that you damage your skin's natural protective barriers, making hygiene part of your health monitoring. Beyond basic cleanliness, your daily hygiene routine presents an excellent opportunity to pay attention to your body and monitor for changes. Take a few extra moments during your cleaning routine to visually and manually check for any new bumps, sores, changes in skin color or texture, or other abnormalities. This simple practice of self-examination can help you catch potential problems early when they're most treatable. Many serious conditions, including skin cancers and sexually transmitted infections, are much more successfully treated when detected in their early stages. Treating your penis with gentle, respectful care during your hygiene routine is actually an act of self-respect and self-care. It's one of the most fundamental ways to maintain your sexual health and demonstrate that you value your body and your well-being. 4. Don't ignore pain, sores, or lumps. When your body sends warning signals, as you enter your 60s and progress through your later years, it becomes increasingly important to pay close attention to the subtle and not-so-subtle signals your body sends you. This is particularly crucial when it comes to pain, sores, or lumps that may appear on your penis or in the surrounding genital area. These symptoms are never just minor inconveniences or things to brush aside due to embarrassment or the hope that they'll resolve on their own. Understanding the significance of symptoms. The appearance of pain, sores, or lumps in the genital area can represent critical warning signs that something more serious might be developing beneath the surface. Early recognition and prompt medical attention can make an enormous difference in your long-term health outcomes and quality of life. You've probably heard the phrase, "If you see something, say something," in other contexts, but this principle is especially vital when it comes to your sexual health. Your body has sophisticated ways of alerting you to problems, and ignoring these signals can have serious consequences. Potential causes and conditions. When you notice a sore that doesn't heal within a reasonable time frame, discover a new lump that feels unusual or different from normal tissue, or experience pain that seems to persist or worsen over time, these aren't random occurrences or coincidences. They could indicate various conditions, ranging from relatively minor and easily treatable to more serious and potentially life-threatening. On the less serious end of the spectrum, these symptoms might indicate common infections, such as sexually transmitted infections, which can occur at any age, urinary tract infections, or localized bacterial or fungal infections. While these conditions require medical attention, they can typically be treated effectively with appropriate medications and usually resolve completely with proper care. However, these same symptoms could also be early warning signs of much more serious conditions, including penile cancer, bladder cancer, or other malignancies. Penile cancer, while relatively rare, becomes more common with advancing age and can present initially as seemingly minor changes in the skin or tissue. Overcoming embarrassment and seeking help. I fully understand how difficult it can be to discuss something so private and personal with your doctor. Many men feel deeply embarrassed about genital issues, worry about being judged, or fear that their concerns will be dismissed or minimized. These feelings are completely normal and understandable, but they shouldn't prevent you from seeking the medical care you need and deserve. It's important to remember that your doctor's primary job is to help you maintain your health and address your medical concerns, not to judge you or make you feel ashamed. Healthcare providers are trained to deal with sensitive issues professionally and compassionately. They've seen it all before, and your concerns are valid and important, regardless of how minor they might seem to you. The critical importance of early detection. The reality is that no matter how minor a symptom might appear, getting it evaluated early can mean the difference between simple, effective treatment and more complex, invasive procedures later on. Early detection and intervention almost always lead to better outcomes, less invasive treatments, shorter recovery times, and better long-term prognosis. When symptoms are ignored or treatment is delayed, several concerning things can happen. Minor infections can spread and become more serious systemic infections. Inflammatory conditions can worsen and cause permanent tissue damage. Most seriously, if cancer is involved, delayed diagnosis can allow it to progress to more advanced stages where treatment is more difficult and outcomes are less favorable. Taking action for your health. Ignoring concerning symptoms doesn't make them disappear. In fact, it often allows them to worsen and become more complicated to treat. The temporary discomfort of discussing intimate health concerns with your doctor is minimal compared to the potential consequences of delayed or missed diagnosis. I always encourage the men I work with to overcome their initial discomfort and seek medical evaluation for any concerning symptoms. Your peace of mind, your health, and potentially your life are worth that moment of vulnerability and honest communication with your healthcare provider. Remember, you are your own best advocate when it comes to your health. Trust your instincts, pay attention to your body's signals, and don't hesitate to speak up when something seems different or concerning. 5. Keep heat away from your testicles, understanding temperature's impact on male health. As you grow older and perhaps become more focused on comfort and relaxation, you might not give much thought to how heat exposure can significantly impact your health. However, your testicles are remarkably sensitive to temperature changes, much more so than you might realize, and this sensitivity has important implications for your overall health and well-being that extend far beyond fertility concerns. As a reason for temperature sensitivity, your testicles hang outside of your body in the scrotum for a very specific and important biological reason. They need to be maintained at a temperature that's several degrees cooler than your core body temperature to function optimally. This isn't just about sperm production, although that's certainly one important function. Your testicles are responsible for producing testosterone, and this process is also temperature sensitive. While fertility might not be your primary concern after 60, the effects of heat on your testicles go far beyond sperm health and have significant implications for your hormone production, energy levels, sexual function, and overall vitality. How heat affects testosterone production. Extended or frequent exposure to heat, whether from long, luxurious soaks in hot tubs, relaxing sessions in saunas, working with a laptop computer resting directly on your lap, or even wearing overly tight clothing that traps heat, can gradually but significantly impact your testosterone production. This effect isn't necessarily immediate or dramatic. Instead, it tends to be a slow, insidious process that chips away at your testosterone levels over time. Since testosterone production naturally begins to decline as you age, adding the stress of excessive heat exposure can accelerate this process and compound the effects of natural aging. The wide-ranging effects of testosterone decline. Testosterone affects far more than just your libido or sexual performance. This crucial hormone plays vital roles in maintaining muscle mass and strength, supporting bone density, regulating mood and mental clarity, maintaining energy levels, supporting cardiovascular health, and contributing to your overall sense of vitality and well-being. When heat exposure contributes to declining testosterone levels, you might experience a range of symptoms that significantly impact your quality of life. These can include persistent fatigue that doesn't improve with rest, decreased motivation and drive, loss of muscle mass and strength, increased body fat, particularly around the midsection, mood changes including irritability or depression, decreased cognitive sharpness, reduced sexual desire and performance, and an overall sense of feeling less like yourself. Recognizing the subtle signs. The changes from excessive heat exposure and resulting testosterone decline aren't always dramatic or sudden. Often, they develop gradually and subtly, making them easy to dismiss as normal aging. You might notice a gradual drop in energy levels, slightly more difficulty achieving or maintaining erections, a slow decline in your confidence and enthusiasm, or a general sense that you're not as physically or mentally sharp as you used to be. While some degree of change is normal with aging, your environment and daily habits play a significant role in how rapidly and severely these changes occur. Excessive heat exposure can be a modifiable factor that, when addressed, can help slow or even partially reverse some of these unwanted changes. Practical strategies for heat management. The good news is that you don't have to completely eliminate all sources of heat or give up enjoyable activities like hot tubs or saunas entirely. The key is moderation, awareness, and making smart adjustments to your habits and environment. For laptop use, keep the computer on a desk, table, or laptop stand rather than directly on your lap. If you must use it on your lap occasionally, place a pillow or laptop pad between the computer and your body to create insulation and airflow. When it comes to hot tubs and saunas, limit your exposure time and frequency. Instead of long, extended sessions, opt for shorter periods and take breaks to allow your body temperature to return to normal. Consider alternating between heat exposure and cooler activities. Pay attention to your clothing choices as well. Tight-fitting pants, synthetic materials that don't breathe well, or heavy clothing in warm weather can create a persistently warm environment around your testicles. Choose breathable, natural fabrics and appropriately loose-fitting clothing when possible. The bigger picture of sexual health maintenance. By being mindful of heat exposure and its effects on your testicles and testosterone production, you're taking an important step in maintaining your sexual health and overall vitality as you age. This is just one example of how small, thoughtful adjustments to your daily habits can have significant positive impacts on your health and well-being. Your sexual health doesn't have to fade away simply because you're getting older. By understanding how environmental factors like heat affect your body and making appropriate modifications, you can help ensure that your body has what it needs to continue supporting your passions, relationships, and overall quality of life. 6. Use it or lose it. The science behind sexual activity and health. As we reach our 60s and beyond, it's easy to fall into the misconception that sexual health is something that simply and inevitably slips away, an unavoidable casualty of the aging process that we must reluctantly accept. However, the truth is far more hopeful and empowering than this common belief, and it centers around one powerful and scientifically supported principle: use it or lose it. This phrase isn't merely a catchy saying or motivational slogan. It represents a fundamental biological truth about how your body works, particularly when it comes to your erectile function, sexual health, and overall physical and psychological well-being. Understanding the physiology of erectile health. When you were younger, your body had sophisticated mechanisms for naturally maintaining the health of your penis and erectile function. During sleep, your body would automatically send oxygen-rich blood into the penile tissue several times throughout the night, creating what are known as nocturnal penile tumescence episodes, essentially nighttime erections that occur during REM sleep cycles. These nocturnal erections serve a crucial biological function that goes far beyond sexual dreaming or arousal. They play an essential role in keeping the erectile tissue flexible, healthy, and well oxygenated. This regular influx of fresh, oxygenated blood helps maintain the health of the smooth muscle fibers, blood vessels, and connective tissues that make normal erectile function possible. The consequences of inactivity. As you age, these natural nighttime erections tend to become less frequent and less robust. This is a normal part of aging, but when this natural decline is combined with reduced sexual activity, whether with a partner or through self-pleasure, your penis can begin to experience what medical professionals call disuse atrophy. Without regular erections and the associated blood flow, several concerning changes can occur over time. The smooth muscle fibers within the erectile chambers of the penis can begin to break down and be replaced by less elastic, scar-like tissue. This process, known as fibrosis, makes it progressively more difficult to achieve and maintain firm erections when you want them most. Additionally, without regular stretching and expansion of the penile tissues during erections, the penis can actually undergo physical changes, including a measurable shortening in length and a loss of that firm, responsive feel that you may have taken for granted in your younger years. The broader health benefits of sexual activity. The use it or lose it principle extends far beyond just the physical mechanics of erectile function. Regular sexual activity, whether with a partner or through masturbation, provides numerous health benefits that contribute to your overall well-being and quality of life. Sexual activity helps maintain healthy hormone levels, particularly testosterone production. It provides cardiovascular exercise that improves blood flow throughout your body, not just your genitals. It releases endorphins and other beneficial neurochemicals that improve mood, reduce stress, and promote better sleep. It helps maintain your connection to your own body and your sense of sexual identity and confidence. Regular sexual activity also helps preserve the neurological pathways involved in sexual response and arousal. Like other aspects of brain function, these pathways benefit from regular use and stimulation to maintain their efficiency and responsiveness. Addressing common concerns and misconceptions. It's important to understand that maintaining sexual activity doesn't mean you need to pressure yourself into constant performance or maintain the same level of sexual activity you had in your younger years. The goal isn't to recreate your 20s or 30s, but rather to maintain a level of sexual connection and activity that feels natural, comfortable, and satisfying for your current life situation. This might mean adjusting your expectations and approaches to accommodate the natural changes that come with aging. It could involve using lubricants to make sexual activity more comfortable, exploring different positions or techniques that work better for your current physical condition, allowing more time for arousal and response, or simply giving yourself permission to enjoy pleasure and intimacy without the pressure of perfect performance. Practical approaches to staying sexually active.
Maintaining sexual activity in your 60th and beyond might require some creativity and adaptation, but it's entirely achievable and beneficial. This could involve carving out dedicated time for intimacy with your partner, exploring new ways of giving and receiving pleasure, prioritizing communication about desires and concerns, using appropriate aids or medications when helpful, and maintaining a positive attitude about sexuality and aging. For men without partners, self-pleasure remains an important and healthy way to maintain sexual function and health. There's no shame in masturbation at any age. It's a normal, healthy sexual activity that can help preserve erectile function, maintain hormone levels, and provide the other health benefits associated with sexual activity. The psychological and relationship benefits.
Staying sexually active in your 60s and beyond provides benefits that extend far beyond the physical. It helps maintain your connection to your own body and sexuality, preserves your sense of masculinity and confidence, strengthens intimate relationships through continued physical and emotional connection, and contributes to overall life satisfaction and mental health. When you maintain an active sex life, you're investing in your overall well-being, your relationships, and your fundamental sense of fulfillment and joy in life. Sexual health is an integral part of overall health, and it deserves the same attention and care that you give to other aspects of your physical and mental well-being. moving forward with confidence. Don't let myths, stereotypes, or societal expectations about aging limit your sexual potential or satisfaction. Your penis, your sexuality, and your capacity for pleasure and intimacy deserve care, attention, and nurturing regardless of your age. The science is clear. Regular sexual activity helps maintain sexual function, and sexual function contributes significantly to overall health and quality of life. As we've explored throughout this guide, there are many practical steps you can take to protect and maintain your sexual health as you age. Staying sexually active is perhaps the most enjoyable and rewarding of these strategies. Final thoughts: embracing your health and your future. As we reach the conclusion of this comprehensive journey together, I want you to remember one fundamental truth that should guide all of your health decisions moving forward. Taking care of your sexual health is ultimately an act of profound self-love and self-respect. It's not about vanity, denial of aging, or desperately clinging to your youth. Instead, it's about honoring the incredible life you've built and the remarkable body that has carried you through all of your experiences, challenges, and triumphs. Reframing your perspective on aging and sexuality.
At 60 and beyond, your needs may indeed change, your desires might shift and evolve, and your body may require different approaches than it did when you were younger. However, your fundamental worth as a person, your capacity for pleasure and intimacy, and your right to sexual health and satisfaction never fade or diminish with age.
It's easy to feel that conversations about sexual health are awkward, taboo, or inappropriate for older adults. Our society often perpetuates harmful stereotypes that suggest sexuality is primarily for the young, or that older adults should be content with declining sexual function. These attitudes are not only wrong, but actively harmful to your health and well-being. Your sexual health is just as important and valid as your cardiovascular health, your mental health, or any other aspect of your overall well-being. When you take the time to notice changes in your body, when you reach out to healthcare providers instead of suffering in silence, and when you prioritize your sexual health, you're giving yourself the best possible chance to remain healthy, vital, and fully engaged with life. Implementing the strategies we've discussed. Moving forward, remember that the strategies we've discussed aren't just theoretical concepts. They're practical, achievable approaches that can make a real difference in your health and quality of life. Perhaps implementing these strategies means making simple but important changes, like swapping out those long, frequent soaks and hot tubs for more moderate exposure, combined with regular brisk walks that get your blood flowing and support your cardiovascular health.
Maybe it means having honest, open conversations with your partner about what feels good and satisfying now, rather than trying to recreate exactly what worked 20 or 30 years ago. Your sexual relationship can evolve and even improve with age if you're willing to communicate, adapt, and explore together. Or perhaps it means simply giving yourself full permission to explore pleasure and intimacy in ways that feel right and comfortable for you at this stage of your life, free from shame, embarrassment, or the burden of unrealistic expectations. The interconnected nature of health. Remember that your sexual health exists as an integral part of your overall health picture, not as an isolated aspect of your well-being. The steps you take to protect your sexual health, choosing gentle hygiene practices, avoiding dangerous quick fixes, paying attention to your body's signals, managing heat exposure, and staying sexually active are also building blocks for a life that's not just longer, but richer, more satisfying, and more deeply fulfilling. These seemingly small daily choices and habits compound over time to create significant positive changes in your overall health, energy levels, confidence, and life satisfaction. Every positive choice you make is an investment in your future self and your continued ability to enjoy all that life has to offer. You are not alone in this journey. As you move forward with implementing these strategies and prioritizing your sexual health, please remember that you are absolutely not alone in this journey. Millions of men your age are asking these same questions, experiencing similar concerns, facing comparable challenges, and taking these same important steps toward a healthier, more fulfilling future. The concerns you have, the changes you're experiencing, and the questions you're asking are all completely normal and shared by countless other men. There's a whole community of people who understand what you're going through and who are committed to supporting each other in the pursuit of better health and continued vitality. You deserve every bit of the care, attention, and effort you're investing in your health. Your commitment to understanding your body, seeking appropriate care, and making positive changes demonstrates wisdom, courage, and genuine self-respect. A message of hope and empowerment. Thank you for taking the time to invest in your health and well-being by engaging with this information. Your willingness to learn, grow, and take positive action for your health is truly commendable and inspiring. Let's continue this important conversation and keep supporting each other in the pursuit of optimal health and well-being. When we take proper care of ourselves physically, mentally, and sexually, we open the door to a life filled with passion, meaningful connections, continued growth, and the kind of deep joy and satisfaction that doesn't diminish with age, but actually grows stronger and more profound with time and experience. Your best years don't have to be behind you. With the right knowledge, approach, and commitment to self-care, your 60S, 70S, 80S, and beyond can be filled with health, vitality, intimacy, and satisfaction. The choice is yours, and the power to create positive change is in your hands.